Hey guys, welcome to our live podcast from Mahajan Medical Center. I'm very excited. We're going to have a fantastic show today. We got Chevon with us, our nurse practitioner. We're very excited. She joined our team about a year ago, and she's been a great addition to our practice. We're going to talk about tips and tricks about virtual school. She has 3 children. One is grown up, so she still have 2 school-going children. I got 2 boys, as you guys know, most of my patients and family that we got 2 boys, 13 and 9, and so we are going through the challenges of doing the virtual schooling at home. And hopefully it ends with the summer and the fall. We get to have the kids go back to the brick and mortar school. We'll be all praying for that. Gave you a breathing exercise last time in our teaser yesterday, in fact. That's a alternate nostril breathing, or nadi shodhana, which is if you do yoga, pranayam, you will probably know, and we'll end with that. So let's get Chevon involved in our discussion today. We're very excited. Chevon is a nurse practitioner, as I said earlier. A lot of you folks who are our patients have seen her expert clinical skills and very empathetic. And she has 3 children, and she's going to share about her personal journey to becoming a nurse practitioner and her motherly skills, which I don't have. I have fatherly skills, which are a little bit more rough. But motherly skills, she's going to allude to that. All right, Chevon, you are in now. I can fix it. Make sure it's focus.
Hi, guys. All right.
So tell us more about you, Chevon. How did you, you are from Michigan, I assume, right?
Yes, I am from Michigan. I moved here, it'll be 3 years in July 2017.
Which part of Michigan are you? Close to Detroit, McKenna Island? McKenna is my favorite place, but...
North of Detroit, so we use our hand a lot. So our hand, you see, we're right there. That's where we're from.
Are you close to the lakes?
Yes.
Which lake are you close to?
Oh, come on. I don't pay attention to that stuff. You're putting me on the spot. So anyhow, we're right here. So there's a lake here, and then
Lake Superior, Lake Erie. All right.
Well, next.
Okay. All right. So were you guys mistake on the lake kind of thing?
What?
Were you mistake on the lake? They talk about Erie as a mistake on the lake.
Oh, I don't know.
They talk about Cleveland as well. But anyway, we're not going to...
So we can ask Wes, this my 9-year-old, or my 11-year-old, those geography questions. I'm not really good with all that stuff, probably because I'm a little nervous right now, too. So anyhow, yes, Michigan. We're glad to be here in Florida, though.
Okay. What got you to Florida other than sunshine and beaches?
We would visit. My mother-in-law lives here, so we would come here for vacations often, and every time we were going home, we talked about how we all wanted to live here. So one day I just said, all right, let's do it. Everybody was on the same page. At that time, I had a 16-year-old. I asked him to make sure he was good because I didn't want to ruin things for him, and he said he was fine with it. So I said, let's do it. So 90 days.
How long have you been a nurse practitioner now?
Since 2014.
Oh, wow.
So 6 years.
6 years.
Yeah.
So tell us what your challenges has been. I know the 16 is what now, 20?
19. He just turned 19.
So 19. So, okay, so you got 2 boys. What's their age range, which are at home schooling?
So the homeschooled kids right now are 11 and 9.
11 and 9. So what's your first week after that, what your experience was, and what can you share? What worked for you, what didn't work for you?
So at first we just had to see how, kind of similar to what Doctor was saying. At first it was a matter of seeing how the kids were going to handle with it. I didn't want to immediately set something up. Let's just see how they dealt with the assignment. So, after the first week, we did have to start going. I don't use the board. I just kind of put their name, and then I write all the expectations for the day as far as what they need to do for what class. So we're working parents, so it's hard, so we have to follow up with that. And I think the biggest thing too is, there's a lack of communication between the parents, the kids, and the teachers. So keeping that communication with the teachers helps the kids to, I think, follow along more and do the right thing as well.
Yeah, I found the same thing. The teachers are overwhelmed, and they are more used to the classroom teaching, and this is brand new for them, and they had a hard time. Their expectation was super high, and they didn't bring their expectations down, and they were not communicating with the parents. Hey, your kid has not done this till it's end of the week, and now the kid has to do all that all over again. They could have set up a method where somehow we get end of the day report card emailed to us, but that's missing from the system. I think if they're going to continue doing it, they need to send to the parents end of the day report card. I found the personal dashboard to be very useful. What's your experience, looking at what they've done, what not?
Yeah, we go to the focus. It's called focus. So at the end of the week, then the teachers will remind us, make sure you check that. That's their grades, and if there's anything missing, and make sure that they do complete that, because they're giving them the opportunity. The teachers are saying the biggest thing is that at this point during school, they've learned all that they've needed to learn. We just have to help reinforce that because they were preparing them for the FSA test. So they have told us that as parents to not expect so much out of the kids, because at first I was, sort of a perfectionist and had very high expectations, and so I'm not a teacher though, so it was kind of hard, but they helped to reassure me that they should already know all this stuff. We're just helping to reinforce, and now we're not doing the testing, so we're just helping to keep them stabilized, so when they start next year they don't go down that curve. They're going to just remain where they're at.
That's great tips, Chevon. So what's your experience working at the best center in Pinellas County for primary care, Mahajan Medical Center, so far?
It's been great. I love it. I was a little nervous at first because I come from a world of urgent care and women's health, but this has allowed me to incorporate a little bit of everything in, and I don't know everything. I know a lot of stuff, so I've been able to pull all of that stuff to the front of my brain and use it and apply it, so it's been great, and I have a great resource, Dr. Mahajan. You guys already know that. So I really enjoyed my time here so far at the office, and then I go to multiple facilities, which I love as well.
So tell us more about your visits to the facilities. Which facilities do you go, and how you think the COVID-19 changed the care, or what you've seen different in the COVID-19 era in the facilities, the nursing home, the ALF. I know they are the hard spots right now.
So I go to Morton Plant Rehab, I go to Pacifica ALF, Princeton ALF, Palm Gardens, Skilled Nursing, and Bel Air. They're actually, all seeming to do a great job. The biggest thing is the visitors, the lack of visitors. The patients really, the residents crave that, and that social interaction is really important. So I think that's the biggest challenge right now, is seeing the residents struggle with that. And the families are struggling too, because they feel sort of out of the loop. But a lot of the facilities are doing a great job at trying to keep close contact and updating them on the families. And I try to keep them updated as much as I can as well.
Great. So you come a few days to the office, and you've worked in a OBGYN practice, and you're very good in well woman care. Do you think that's one of your strengths you bring to the practice?
I do. Because no matter your age, you still need to have those exams done. So I feel confident in that area, and I definitely feel like it's a good asset. And
great.
Plus, you guys can come see me, and we can get all, well, you ladies can come see me, we can get everything figured out.
All right. Thank you so much, Chevon. I know you were nervous, but you did a great job. Thank you for your insight and how you've done so well with your kids, and how you're doing a good job with keeping the families informed in the facilities, and keeping their stress level a bit down. I know patients in the facilities, when they're around with you, they love you there, and it's good to see a friendly face there, other than other nurses. So that's great. So keep up the good work.
Thank you.